Hello and welcome to the new series of the Research Sofa. I'm here today with Helen Twohig, who's a doctoral research fellow and GP, and she's going to tell us today about the collaboration project she's set up as part of our collaboration fund. So, Helen, why did you set up the collaboration project that you've recently set up?
Hi. I guess I became interested in this particular topic area because back in March, at the start of the pandemic, my clinical job changed dramatically almost overnight, going from seeing people face to face to doing almost all our contacts via phone and a very, very small amount by video. And myself and many others had particular concerns that this change might really impact certain groups more than others, impact them negatively. And people with severe mental illness might conceivably struggle more to access and engage with care delivered in this way. Now, any large-scale change such as the one that happened would normally be done with planning and with input from people whom it most likely affect. And obviously this change didn't happen that way. So we're now in a position where we're sort of retrospectively trying to understand the impact of the switch from face-to-face work to mainly remote consultations, and understanding both the positives and negatives of that, and working out who is most affected by that. So I came together with a team of people from both Keele and Sheffield universities, and we have a couple of lay members on our team as well, to look at how we could explore and understand the effects of this change. And that's when we approached the Closing the Gap Collaboration Fund to support us setting up some stakeholder engagement meetings.
Yeah, and you recently held your first stakeholder engagement meeting, and you shared some really lovely outputs with us. That's been part of the meeting. Can you just tell us a little bit about what you found at that meeting?
Yeah, so we held two meetings just last week. One with service users and representatives from mental health charities, and one with healthcare professionals. So it was a mixture of GPs and practice nurses. And we had, as you mentioned, we had a live scribe with us, who was able to, she was a social researcher and a graphic designer, and she was able to sort of visually depict the discussions as they went along. So we had a really nice output at the end of it. So they were really interesting discussions and people were very engaged. And I think the thing that most came across was that both groups were really feeling the loss of face-to-face consultations. One GP said she was grieving the loss of being able to see her patients. One service user said she was absolutely terrified that things wouldn't return to what she saw as normality and the best way for her to see her known GP and nurse. So that came through really strongly. And I think one of the key points that went along with that was the real importance of continuity of care, and that if there was already an existing relationship, then actually the switch to telephone consultations, at least for a period of time, could be managed well and could be relatively seamless. But that if it was a new problem presenting, or a new interaction between a patient and a clinician, that was really hard by phone or video. So I think that was an important take-home point, really. One suggestion was that maybe it should be, where possible, that it would be really important to make the time to see somebody face-to-face really early on in that new presentation or that new relationship. And that should really be viewed as almost as important as when we make the time to see somebody for a physical examination, if it's felt that that's needed as part of their care. You know, we make these judgments about balance and risks of getting somebody in to see them face to face, and the risks of, and the infection control measures, versus dealing with what can be done over the phone. And it was just an important message really to come across, was that seeing somebody face to face at least once to start building the relationship and to enable a more in-depth discussion than you might get by phone. It was actually a really important thing to consider.
Yeah.
We also discussed a lot about the use of technology. There was a lot of frustration about people being able to access appointments, about systems where people have to just told, yes, you'll get a call back today, and then they don't know what time and they're sat waiting all day. And frustrations on both sides, really, that the system wasn't working that well at the moment, although acknowledgement that things had improved greatly from at the start back in March to how systems are now. There was concern from both groups, I think, about people being digitally excluded. So obviously our group was held online, so we had a sort of self-selection already, but actually we probably still weren't hearing the voices of those who can't use that kind of technology. One service user suggested as a potential solution to this would be to have a community of ambassadors who could help people in their practice area with technology that they needed to be able to access their GP service. I thought that was quite an interesting idea that we need to think a bit more about.
Yeah, so it sounds like it was a really good couple of meetings that you had, lots of new insights gained and thinking about things. And so what do you think the next steps are for your project?
So as I say, we only had the meetings last week. So I think we need to come together as a team and look at the potential research ideas that have arisen from the discussions and the potential areas for practical changes for service improvements that could be made. And then we really want to keep the service user involvement going throughout this work. So try anything that we do, we would hopefully sort of co-produce any changes or co-produce any further research that arises from this, to really see what we can do for this particular group to facilitate and enable them to access this sort of new way of delivering primary care in the best way that they can.
Yeah, thank you. That's all really interesting. So it's really nice to have you on the sofa today. Tell us about your project, and we hope to be hearing more about it in the future as you move through and develop more research in this area of remote consultations in primary care. So thanks very much for joining us today. Thank you everyone for watching.
Thanks.
Thank you and goodbye.
Bye.